Thank you. Thank you, Mr. Bell. I want to take you to your submission. You say in your submission, and I will quote you directly, you say, quote, any significant change to the NDIS will include risks and unintended consequences. By working with the provider sector, government can quickly identify and manage risks as they arise. For example, an anticipated risk is for participants with psychosocial disabilities. In many cases, the social and community participation supports for these participants currently provide, you say, a level of regular contact and monitoring for their treatment and consistency with medication. Funding reductions may see regular contact reduce, and with this, the risk of a participant coming off their medication increases. In this example, the participant may place greater demands on other parts of the health system. For example, presenting to hospital and other social services, and in extreme cases, posing a safety risk to the community, end quote. Now, you say it's quite easy to mitigate risks such as this. How would you mitigate this one?
I'm not sure I said it was easy to mitigate risks.
Well, that's certainly the tenor and tone of your submission.
When we talk about the risks and the mitigation, what I'm referring to there is service redesign. I can give you an example that's practical. And I do take your point about demand and supply. We're talking about reducing supply for a demand. It is likely, and I've expressed this point to departments and others, that some of that demand will reappear in other areas of the system. I think that is well understood and has been expressed to you previously, but perhaps not at a one-to-one ratio, but it will reappear at some stages, whether it's social services or other different areas. So I do take your point on demand and supply and that demand being looking for somewhere else.
Just to be clear, Mr. Bell, what I'm bringing you to, and again, this is your submission, you're saying in this submission that participants with psychosocial disabilities currently part of the benefit they get out of social and community participation supports they're funded for is that they get regular contact with other people, having beneficiary effects such as ensuring they are continuing to stay on their medication, for want of a better word, and that cuts in that support, cuts proposed by the government via this legislation, could see that human contact decrease, leading to risks such as them not taking their medication effectively as instructed, with the flow-through impact that they end up in hospital or relying on other social services or posing other risks to themselves or to the community. That's the risk that you've identified, and it's a risk you suggest can be mitigated. So my question to you is, how are you proposing that risk be mitigated? Not service design. How are you proposing it be mitigated in that specific example?
I think I would take you to service design as the mitigant. I'll give you an example, if I could, where a participant perhaps might be funded for, and this is very simplistic, but it's for demonstration purposes only, and to take me that please. Where a person may be funded for 10 hours per week, let's say, for example, at the moment, and that were to be cut to 6 hours. The way the economics and the practice would work is we would then look to redesign that service around capacity building. Rather than servicing to ensure that particular boxes are ticked on tasks, we would look to capacity build individuals to make them better able to maintain their own medications, to maintain social contacts.
And that's an example, Mr. Bell, of how you would mitigate a risk in an example. I want you to tell me how you really mitigate the risk in the literal example you've given us. So you've given us an example of a psychosocial participant who experiences social contact regularly because of social and community participation funding. You've identified that this legislation poses a risk to that person in the form of that funding being reduced, but you are suggesting that that risk can be mitigated for that participant in that example.
Yes.
So I'm asking you how you're doing that specific example.
And Senator, I'm seeking to answer your question by the way we would approach and mitigate that risk is by capacity building so that that person is learning and capable of medicating and taking medications on a less monitored basis where appropriate, and also making sure that they are available or they are directed to any other sources of social help where they need to, where their supports are unavailable, just like they would in the hours that we are not present with them as well.
But so capacity building is also going to be cut by 10%.
That may be correct, and this is why we will be redesigning the services to fit the available budgets. The point that I'm making there is that I think that it is imperative that the industry understands the dynamic and the restrictions and redesign services to make sure that the service levels are maintained as best we can and help identify these risks with the government and source the solutions to them.
Okay, so you're talking about design, you're talking about working with government. There seems to be quite a disconnect between what you've actually given us, the human example you've given us in your submission, and what you've just said to us, because surely if you've identified this risk as you have, you surely would attempt to prevent this situation occurring before the passage of the legislation. Why do the redesign once the participant is at risk?
We're not. I'm explaining to you how we would redesign services to change the design based on a funding requirement. The funding requirements are changing now. We're not waiting for the bill to redesign services.
But you're sitting here today advocating that the legislation pass, correct?
As amended following the Senate hearings?
Yes. So there's been a series of amendments made to the legislation already. And
any others that you would see fit to be seeking to make following these hearings as well.
Right, so your support of this legislation is based on amendments that you haven't seen?
Well, my support for the bill, Senator, is that I have faith and confidence in this committee, the ministers and the Australian Parliament to deliver a best balanced outcome for participants, to the community, to the taxpayers and participants, and balance those interests in the interests of the sustainability of the scheme long term.
So how are you suggesting the legislation be amended to manage this risk?
I'm saying we would change our business practice to manage this risk as best we can. My example
as best you can.
My example is given to you as to what how an industry would react to that change and how we would mitigate that risk and seek to mitigate that risks.
You seek to mitigate is not the same as successfully mitigate, though, is it, Mr. Bell?
I can't give you absolutes, I'm sorry, Senator, on any supports or mitigants. They just, unfortunately, don't exist.
So you can't guarantee that, subject to the passage of this legislation, you would be able to mitigate the risk you've identified to a participant who...
I couldn't guarantee you that I could mitigate every risk in our business on every day of the week either. It's a nature of the business that we operate in. We are incredibly focused on quality, on support. We are scaled. We are collectively as a group over 200 years of legacy and experience, dedication to continue, dedicated to be sustainable for decades to come as well. There are no guarantees. We work as best we can under all of the regulatory guidance and all the regulatory frameworks that we do are compliant. We're registered, we're compliant, we're audited. There are no guarantees, unfortunately, but we absolutely think that the redesign of the services can help those situations. And in fact, we aren't waiting for the bill to do those activities because we've seen the reduction in plans already.
And that is precisely my point, Mr. Bell. You've identified for us a specific risk to a specific type of participant, a specific person that your entity supports. And yet you can't guarantee that should this legislation pass, you will be able to mitigate a serious risk to their health and safety. And yet you've come before us today without a specific set of legislative amendments that you would like to see pass that would guarantee that person's safety and the mitigation of the risk. You're just saying to us, well, you as an organisation trust the government to solve a problem.
Senator, I can't guarantee you before the bill. I can't guarantee you today. The cuts are taking place to plans as we speak. We are needing to redesign services now. So the bill doesn't impact on our desire to mitigate risk. I can't guarantee you today. I couldn't guarantee you in next week. But we're taking those actions at the moment.
You're not suggesting to me, Mr. Bell, are you, that the government's implementing this legislation?
Oh, by no
its
means,
passage?
no. In fact, I'm quite confident they are not. I'm quite confident that the agency themselves are implementing plan reductions. We see it daily and weekly. That's no secret. Many people have come before you and have told you that's taking place.
Yeah, and we are not conducting an inquiry, unfortunately. I'd love to, into the broader dynamic of agency cuts. We're looking at what this legislation could do, particularly a unilateral across-the-board 50% reduction in the very type of support you've identified as being necessary to the people your company works with to enable and ensure that they continue to take their medication regularly, keeping them and others safe. And so I've asked you repeatedly now to identify for us as a committee either the amendments we should propose to this legislation to mitigate the risk to those participants, or the ways in which you propose in that situation where the bill passes, you would mitigate those risks. And you have said you are unable to give us a guarantee that you can recommend them, you can mitigate those risks, and aren't able to identify the amendments that would enable you to do so.
But I take you back to my comment and response around the mitigant and the service redesign. Those services, the mitigants are in place. I can guarantee you we will mitigate risk, but I can't give you a guarantee that there's some scenario where there is zero risk. We mitigate risk every day. Training, quality standards, scale, all of those things are mitigants to making sure that we can deliver the best quality of service possible. I can't give a guarantee of a risk-free environment.
Thank you very much, Chair. Appreciate it.